As a state government, we've tried our best at least to ensure, so we can debate it here. Looking at the resources available to us, I think the Lagos state government is paying reasonably well. So finance is a major problem and is a major cause of salary conflict.
Okay. Let's take our final time out, and we'll be back, in which I'll try to see the Lagos state government strategy for some specific diseases that afflict our people. We'll be right back.
Who knows a bit better thing? Abi who know like better thing? All these fine things where they see so. Now money government they take do now. Abi, I think it's like, I mean, excuse me, I dey pay my tax. I dey do it thing, I dey pay my tax. Say you don't pay your own tax. As you pay your tax, I pay oh.
Pay your tax. It's your civic responsibility. It's your duty. It's the law.
You're welcome back. It's the Policy Council, and our guest is Dr. Jide Idris, Lagos State Commissioner for Health. Yeah, before I go into those core diseases I mentioned, the recurring problem in the health sector as even emerged from your discussions is financing. Do you have a strategy for sustainable financing in terms of health insurance and all of that? What's your attitude towards that?
Well, we've looked at it seriously, and we feel that is the right way to go. And because, like I did tell you, we've been solely dependent on budget provision to health sector. No matter how it is, it's still inadequate. I'm looking at the provision we serve. And again, so that in the past, we have adopted some policies of free health. We also do know that free health is not sustainable. We can't fund it properly, and that's why we try to target to some population, children 12 years and below, adults 65 years and below. At the end of the day, to do that, a lot of people still pay out of their pocket. And the tendency that, look, people who pay out of their pocket are the people who end up suffering, because there's no pooling mechanism to cater for those poor people. And we've piloted some community-based health insurance schemes, because we said we address the informal sector. We could do that where the huge is. So we've piloted this scheme in Ikosishere local government. We started one in Bejuleki and last one in Ajeromi. And we've done that now. If you remember, last week or 2 weeks ago, we had a state council on health. The theme was universal coverage, and the sub-theme is the healthcare financing and reducing maternal and child mortality. During that sub-theme, we gathered information, and which we are now pulling together ideas to pull that come up with a proper financial health insurance scheme for the state using the community base. So we're going to roll out very soon. But we need to enlighten the public, because it's a change in direction. People, some kind of prepayment contributory scheme, and the government will have to subsidize, especially for the poor people with us. So we're on track.
Excellent, excellent. I'm happy to hear that. So let's, as we close, see what the state's government strategy is for disease specific. We have malaria, tuberculosis, HIV/AIDS. Can you talk about those ones first?
Malaria, we have a robust malaria control. I can boast of that many states do not even have that, even the federal government, because we have a control system in place, being implemented by a committee drawn from different sources, both public sector, the academia, and basically the idea was we adopted all the various control mechanisms: environmental control, vector control, treatment, public safety, and even research. And we run into the indoor residual spraying, which is what a lot of countries have done to be able to eradicate malaria. And we've done that in about 6 local government areas and 11 local council development areas, industrial spraying. And
tuberculosis?
Tuberculosis is a major burden. And once you have it, you have to be treated. If you have to be treated for at least 9 months with a full, and so it's expensive. We have that control issue, and again, the control measure also involves developing testing centers, rapid diagnosis centers, training people, and we have about 42 diagnosis centers now for TB. We have a major laboratory center in the mainland where now we are beginning to have resistant TB, and so we needed to address that. But with support from some external agency, we build that structure there. But I must tell you, treating tuberculosis is huge. And in the context of HIV/AIDS, they are twin brothers.
Yes, I wanted you to
So
discuss HIV/AIDS as well.
it's a compound issue too. We did a prevalence study for Lagos. It was about 5.1 for HIV/AIDS, but again, we have
5.1%.
Yeah,
and if we're 20 million,
yeah, it's quite high. Again, you have to look at the migration of people from outside of the state again. Yeah, the migration of people from outside of the state again. So that's what compounds the issue. So we are doing that. We are providing treatment centers, counseling and diagnosis centers, also so many things. But again, the problem is that once you make the diagnosis, the person is on treatment for life, and again, cost of this is expensive, and this also coming under the free health scheme because a lot of people there cannot afford that. So you can now understand the constraints government is having.
I would have loved to talk about some other major diseases, but we don't have time. But it's been an enlightening and educative discussion with the Lagos State Commissioner for Health. Thank you very much, sir, for coming.
You're welcome.
We'll be right back. That's been a very enlightening discussion, like I said. The Lagos State government now clearly has a clear strategy for the primary, the secondary, and the tertiary levels of health. And fortunately has made the discovery that seeking a sustainable financing system for healthcare is the only way we can cover the whole of our population. We wish them success so that our people do not die at home or die in India or somewhere else. Thank you very much for watching. See you next time.